Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope you're well, and I hope this brings some enlightenment and education to you today. Today at Longevity Health Institute, for some reason, things came in threes, and they were relative to cardiovascular, actually atrial fibrillation. Three different patients actually that had atrial fibrillation, one that was just newly discovered, two that were discovered on their own, and one through a cardiologist. But what's interesting about these three cases today is we're going to help them here at Longevity Health Institute with a personalized functional medical approach. And they're going to see their cardiologist and they're going to follow their cardiologist, but we're going to add a little bit of, if you will, secret sauce into what their therapy and their treatment is going to be, as well as maybe screening them a little bit further. And in most of these cases, what we do is we approach them from a structural standpoint, if it's not already been done by cardiology or the hospital, and that is we look at to make sure that they don't have any heart valvular issues or carotid plaque or stenotic issues. We'll screen them for this with Dopplers, stress tests, and echoes. And you've heard me talk about before, even patients getting calcium scores, cardiac calcium scores. Wonderful screen, wonderful advanced screen we do here all the time. All my concierge VIP patients get that. And the reason is because it's very hard to predict cardiac risk. We can talk about data, but the reality is 15% of people will pass a stress test and still have a cardiac event after a stress test. It'll be missed. So, we find this, we see this. In fact, I actually had a patient just this winter down in Florida. He was a snowbird, and he went down to Florida after his cardiologist had him do a treadmill stress test that he had passed, that he did wonderful, and he had actually a small heart attack in Florida, luckily was caught and had some intervention down in Florida, had chest pain with exercise and walking and that, and he had a 90% stenotic left anterior descending artery, an LAD artery. And there is significant risk, obviously, to that, even death. They call that the widowmaker. And he passed stress test. He's 72 years old. Why did he pass them? And why was it not caught? Probably because he has a lot of angiogenesis and other vasculature around that stenotic and blocked artery in his coronaries, and so he's getting good blood flow, and his heart then is getting good viability. And so unless he's had a very high heart rate or very high demands on the heart from an oxygen consumption effect, he is not going to have chest pain or heaviness in the chest or squeezing or anything like that. He plays baseball, he works out 3-4 times a day, he's very active, 72-year-old, does yard work, etc. So until he actually did some vigorous work in some warmer weather and was walking, etc., that's when he developed chest pain. So calcium cardiac scores are wonderful lifesavers. We do it here all the time. Proud to do them, proud to preach to them about them, because they can save lives, save your life, save families' lives. But back to the AFib, a couple things other than ruling out structural heart disease is that we'll always consider nutrients and hormones in digestive health. Actually, leaky gut, and you've heard me talk about leaky gut and digestive permeability issues of the digestive system, and that can cause somebody to have a sensitivity to whether it's medication, certain foods, certain stimulants, alcohol, caffeines, etc. And what happens is that makes the heart more excitable. They'll get palpitations, they'll get premature atrial contractions, and they'll get PVCs, or these palpitations, and AFib then, and higher heart rates are a risk. Electrolytes can play a role. Magnesium is huge nutrient that you hear me preach about and we use in our practice every day for cardiac prevention and arrhythmia prevention, as well as many other benefits that magnesium can alleviate, like sleep, like bowel relaxation, like anxiety. But atrial fibrillation will consider the gut, will consider nutrients, will consider leaky gut, make sure somebody's detoxifying. And there's a lot of evidence that postmenopausal and post-andropausal, that's men and hormones, that hormonal decline does put them at risk for cardiac events. And why is that? Well, all-cause cardiovascular events are much higher in somebody at those ages, and we believe that there's some protective value to hormones. And if they're not in the appropriate balance level. They're deficient. Things like hardening of the arteries, atherosclerosis, hypertension, prediabetes and type 2 diabetes. These are all risks that lead to cardiovascular events and even atrial fibrillation and cardiac events. We believe that there's remodeling done to the heart when you don't have the adequate hormone there, so the valves and part of the heart structure actually over time can shift and change, which gives electrical current issues in the heart, and then AFib is a bigger risk to the patient. So you got to look at it as a whole. As we always do here, personalized medicine, look at patients head to toe, look at it as a whole. But I also want to discuss with you something that everybody out there is going to find enlightening, and everybody always has this question. And I'm going to put this on our next video, and it's related to cholesterol and cardiovascular disease and potential statin use and egg consumption. Everybody asks, are eggs good for you or eggs bad for you? So stay tuned to my next video, and we'll further this conversation about heart prevention, cardiovascular risks, and what is some of the new data in March of 2019 from the American College of Cardiology. So you know me, I'm all about prevention, looking at you as a whole. You heard some enlightening things about AFib and magnesium, so put them to use with you and your loved ones. This is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well.